Hello, Donald Johannesson here, and I'm at the National Suicide Prevention Conference in Brisbane. We're going to have a chat to some of the people to find out what is happening from a suicide point of view and find out how funding is affecting communities, organisations to deliver services to people who need it most.
Most of the community work are done by the elders, the traditional skin groups, young youth. We're all doing it for free. And the resources that we get, we teach each other.
The thing about suicide prevention is suicide is everyone's business.
What we know is we've had 5 Aboriginal lesbians take their lives in the last 3 years.
So this is Hayley. She's a member of our Lived Experience Network who has survived suicide and also been a carer for someone with suicidal behaviour.
We were all boys once, and what happens in childhood has a massive impact on your health and well-being.
This work, it's all about money. If you don't have the money, you can't really do anything.
There was a younger fella who got an award from Tasmania, and he actually has received a number of awards, but one of the things he said was he would do anything. He would give back every single award that he's ever received just to have his younger brother back.
If somebody says they're feeling suicidal, take it seriously.
Hello, Donald Johannesson here with Which Way Your Health, coming to you from the National Suicide Prevention Conference in Brisbane. We're going to have a chat to some of the stakeholders to find out how suicide is being combated in communities.
Dr. Jennifer Bowers, and Chief Executive of Rural and Remote Mental Health. And we have 3 programs called Deadly Thinking, Resource Minds and Rural Minds. Our programs, and particularly Deadly Thinking, is a primary prevention program. It's a trainer-trainer program where we train up people in communities for communities. We look for community leaders, people who are respected within the community. They need no particular skills, so we look for trainers so we can bed the information that we provide in our prevention program into that community.
Jennifer, the Courier Mail reported in the paper last week about construction and that industry and how high the rate of suicide is. Have you noticed something like that in the mining section, in the construction section, and that's an area that you guys should be focusing on?
Yes, absolutely we have, and it's really unfortunate because so often people ask us for our prevention programs after something a traumatic event, and that's very distressing for everybody. We really want to get out there and prevent that happening, and we need to go out there and start looking at that and persuading people not only to talk to each other and have that conversation, have that yarning session, but equally know when to ask the question about suicide, are you okay, and then do something about it, know what that early intervention might be, and that's what we equip people to do.
My name is Dr. Vanessa Lee. I work for the University of Sydney. I'm here under my position as the Director on the Board of Suicide Prevention Australia. I'm a social epidemiologist in public health and medicine, so I look at the social association or the social causes of the burden of disease. Well, this is the second conference that I've helped organise, both of them on suicide prevention. And the thing about suicide prevention is suicide is everyone's business, and drawing that together and bringing people in, it's all about juggling time and diaries and letting people know that we actually mean what we say, and there's no pretense around it, and that's really important. We didn't have any money because SPA is a non-for-profit organisation, so we had to raise a lot of the money. We had a lot of meetings. We had an Aboriginal and Torres Strait Islander specific group that fed into the mainstream group in the organising committee, and there were 4 of us on that group, which is pretty good because there's 560 people at this conference, and we were able to give out 18 Aboriginal and Torres Strait Islander bursaries, as well as have a dedicated Indigenous lab for speakers over the whole conference of the 3 days. We've also been able to engage the LGBTIQ community, sexuality and gender diverse, and we've also brought them in and integrated them into all the streams as well. So if there's Aboriginal and Torres Strait Islander LGBTIQ issues, if there's mainstream LGBTIQ issues, we've brought them all in together so that we have a full integrated conference basically. Today I spoke about the digital mental health gateway that the Department of Health is in the process of developing. It came out of the 2015 mental health reform, and it was put in a media release by the then Minister Susan Lays, and when it was highlighted as one of the 5 points of the mental health reform, and to come all this way with it in this digital mental health reform is really interesting, because in my discussion I actually spoke to people about digital mental health gateway, and in that gateway, you know, a lot of issues came out for Aboriginal and Torres Strait Islander communities. Things were highlighted about access to the internet, access to mental health services, the lack of access to counsellors and trauma counsellors on communities. And you know, when you look at data, you don't just look at data as in numbers. You have to look at all the association around data. Why do we have such a high prevalence in suicide in Aboriginal and Torres Strait Islander communities? Why are our children committing suicide, and why is there a ripple effect? Why is all this going on? So it's looking at the stresses around that. What does racism have to do with it? You know, in some data sets, they say it's 50% of Aboriginal and Torres Strait Islander people have experienced racism. In others, it's 75. In other data sets, it's as high as 95. You know, and I don't think there is one Aboriginal and Torres Strait Islander person that hasn't experienced racism. That sort of data should then be translated into policy and funding for services. And that's what we want to see. The Digital Mental Health Gateway talks about how we can actually get people to get online and start having a look at to see what services they can access for themselves online.
My name's Rebecca Johnson, and I'm the co-founder of Indigiles, Leadership and Support Group for Aboriginal and Torres Strait Islander lesbians. Indigiles provides support and leadership to, you know, our Indigenous lesbians across the state that experience isolation and discrimination in community. And also in the wider community, and we look at the effects of, you know, that isolation and discrimination, how it affects them in terms of mental health and suicide, and we address the issues that people don't speak about in community, and that's women. That's a small number of women that are attracted to the same sex, and we have a look at what service deliveries we can link them with, and where we can refer them to that's most appropriate. And sometimes that's not our AMSs, sometimes that are services that are inclusive of GLBTIQ people, and appropriate services that understand the journey of sexuality and the journey of coming out, and understanding that first and foremost that we are Aboriginal and Torres Strait Islander women, and the discovery of who we are as lesbians. There's a journey in that process. And that journey needs to be, we need to provide them with the most appropriate health services, the most appropriate services to help them with mental health and, you know, thoughts around suicide and stuff like that. We have an Indigiles Facebook site that they can contact us on, or we have a website, it's www.indigiles.org.
My name's Summer Finlay. I'm a Yorta Yorta woman, and I grew up in a Wabakal country, Lake Macquarie. I wear a number of hats, one of them being Croaky, which is a health news outlet.
We're here in Brisbane for the National Suicide Prevention Conference. What have you learnt so far from this conference?
One of the things I've learnt, probably the most significant thing, which it's kind of obvious, and I felt like I should have known it before, but is the amazing resilience of people that are actually working in this space. Pretty much everyone has actually been touched by suicide, black or white, and some people's stories are they just blow you away. They've had so much trauma, and yet they're here trying to do something to make a difference, to reduce the impact that suicide has on our communities. And a lot of people do it out of love and compassion for communities with very little money, and I know that's probably not having learnt something, but it actually is something that I think shows the strength within Australian communities and people. I was just listening to Suicide Story. One of the things that I really like about what they do, so they're a program based in Alice Springs. They actually train people up and to work in their communities, but the basis is resilience. And what they want to do is actually make sure they don't just go in when there's a crisis and then leave nothing. They're actually going in and working with people, so when they actually leave, they're not leaving the community defenceless, they're leaving the community with skills to actually deal with things if it comes up again.
You delivered us a talk. What was that about?
So through Croaky I write and do videos on Aboriginal health, and through my experiences I've learned how to engage with media. So I actually work in public health policy and research, that's my background, and occasionally I pretend to be a journalist. And so what I was doing was working with a bunch of people actually saying, hey look, you can use the media. A lot of our mob are really shy around media because of the way we've been reported or with negative experiences, but actually working with people about how they can use it to their advantage and how to actually shape a message. Talking about maybe, getting together your community when a tragedy's happened and actually talking about what it is you wanted to communicate. Not just about what's just happened, but maybe some of the strengths in your community, some of the programs you're running that might need funding to continue that are actually supporting these kind of things in your community. So it was really talking about that kind of stuff, but also what language to avoid. We see a lot of sensational stuff in the media about Aboriginal people. We also see a lot of deficit. We don't want to continue to perpetrate that kind of dialogue. So also thinking about making sure that you are using strengths-based language, not just talking about deficit, because, lots of people say it, but we're never actually going to be able to be trusted to run our own business if everyone thinks that we are nothing but deficit.
My name's Taz Clay. I am part of the National Youth Reference Group for Headspace National based in Melbourne. I've had probably like a handful of attempts. Most of the time I was under the influence of alcohol, and it just wasn't good. We had lost our mum. Probably in the 12 months after losing mum was the most turbulent time of my life so far, and it almost seemed like the best idea. Like I didn't know what I was going to do. Like school, I wasn't too good at school, and I don't know, there's nothing else to do. And no one was willing to go the extra mile, I guess, to kick me out the butt. If I have issues, like I'll discuss things with friends and I'll discuss things with family, but I very much have issues that I'll only discuss with like a psychologist or a counsellor, just because of the stuff attached to it. It's not something that I feel like people my own age can handle, and so and that's just my safety thing. That's what I do, because I do cherish the friendships and relationships I do have now, and I think if you can trust a professional, you're going to go a lot farther with, treatment to say, than, having a yarn to everyone and not having something that they can actually, they know how to deal with it. They get paid to deal with it. So I think it's important to utilise that.
Hi, I'm Glenn Poole and I'm the Development Officer of the Australian Men's Health Forum.
Tell us about your organisation, Glenn.
So the Australian Men's Health Forum is the peak body for men's health in Australia, and we're focused on the social issues that impact men and boys. And one of the key areas of concern we have is the fact that of 8 people a day who die by suicide in Australia, 6 of them are men and boys.
Men's health at the moment, how is it from the data that you've probably collected through the organisation? Where are we at?
Yeah, so there's a lot of areas of concern in terms of men's health. The key one is that we live a shorter life. So men on average die 4 to 5 years younger than women and girls from the same background, and that's exaggerated even further if you look at the health of Aboriginal and Torres Strait Islander males who live about 10 or 11 years younger than non-Indigenous men in Australia. Some key areas of concern are there's not a great focus on male-friendly services, so we need to get better at helping men and boys access services, and there's also a lack of funding into research around men's health, some research a couple of years ago found out that about 4 times more funding goes into women's health than men's health. So we haven't got a good evidence base about what works and what we need to do.
It's interesting you're using the term boys. I mean, that's where it's got to start. Is that right?
Yeah, completely. We were all boys once, and what happens in childhood has a massive impact on your health and well-being in terms of, you know, the family you're born into, your social and economic background, the quality of your education. So one of the things we know is that boys aren't doing as well at school as girls on average, and that has an impact on your health and well-being throughout your life. So yeah, if we can get it right at the start, make sure boys are getting a good education, a good sense of how to form good relationships, are prepared for a world where they can benefit from the economy and have good work and all the rest of it. That will set them up for good health later in life.
You know, I think there's 3 things that you can look out for. Firstly, if somebody says they're feeling suicidal, take it seriously. Don't just pass it off or think, oh, they're just joking around. If someone is expressing that, then take a step, ask them what's going on, why are they saying that, how are they feeling. The second thing to look out for, though, is maybe you can see a person is really distressed about something. Now, usually that comes out in emotions, all sorts of emotions. Maybe they become very, very sad, maybe they become very angry. Maybe they just look like they're feeling really hopeless about things. So be sensitive to the emotional distress somebody's showing and ask them about it, what's going on. And the third thing is, look out if you see somebody seems to be changing in their behaviour. They do something you think, well, that's a bit out of character, or I didn't expect them to do that. Because it might be suggesting something else is going on underneath. And that's a good opportunity then to say, look, I just want to understand, you know, what happened back there? Why did you do that? And how are you going?